to all the Gynecology Obstetrics 2024 delegates for providing a brilliant platform for dissemination of emerging concepts in the ever-expanding complex gynecology obstetrics field pre-post the coronavirus Omicron global pandemic. I'm Dr. Saumya Pandey, PhD, recently worked as head Department of Clinical Research in a prestigious fertility health hospital based in India. And it's a privilege for me to present my work and have an enriching platform for effective dissemination of emerging scientific concepts. The title for my talk is In Vitro Fertilization Success Trends Amongst Infertile Women of Asian Indian Ethnicity, Breakthroughs in Maternal-Fetal Medicine. Clinical research snapshot. The objectives. Infertility is a major public health problem globally, including India. Etiopathogenesis of reproductive disorders amongst ethnically disparate populations is a made complex. Therefore, cost-effective, evidence-based intervention strategies are indeed essential for infertility control and prevention. My pilot study aimed to assess the in vitro fertilization success trends amongst infertile women of Asian Indian ethnicity. A quick overview of the methods. A prospective clinical research study enrolling 1380 infertile women undergoing ART procedures at Indira IVF Hospital, Udaipur, India, was rigorously conducted, and the inclusion criteria included age less than 35 years, Indian ethnicity, BMI less than 25 kg per meter square, AMH 1.5 to 2.5 ng per ml, and exclusion criteria stringent, prior more than 2 IVF failures, fibroids, adenomyosis, cervical cancer, thin endometriosis. IVF success was determined by assessing total frozen embryos transferred per month, average oocyte yield per owner, oocyte quality, and pregnancy beta human chorionic gonadotropin positivity. Now, the psychosexual intervention incorporated marital relation counseling sessions therapy, reference for psychiatric assessments, including cognitive impairment, schizophrenia, depression, and written informed consent of our patients was taken at initial enrollment. The results of the maternal-fetal medicine study highlighted promising IVF success rates in Asian Indian infertile women, warranting future public health research, awareness campaigns, psychosocial interventions, and pharmacological therapeutic biomarker development for infertility management in ethnically disparate populations. Next slide, please. There are a few emerging clinically relevant burning questions that demand immediate attention of the scientific and clinical research community and fraternity worldwide. Oocyte maturational competence and integrity, sperm function, quality, pre-embryo culture conditions, pre-embryo morphology, ovarian age are indeed significant physiological immunobiological factors for determining a successful implantation and or pregnancy outcome in a specific subset of infertile women of ethnically disparate populations. So I speculate whether receptors and inhibitors in cell signaling, biochemical signaling pathways may be the eventual cost-effective predictive and prognostic biomarkers in global infertility management in the near future, more so pre-post coronavirus Omicron global pandemic, with life-threatening scenario and uncertainties, including financial hardships that women of childbearing age have to face in recent times, so as to reduce the increasing psychosocial, financial distress, and overall quality of life associated with infertility treatment amongst infertile couples of differential socioeconomic status, US dollars, Indian rupees, UK pounds sterling, at reproductive medicine laboratories, medical centers, stringently managed by a highly qualified scientific expert and clinical team members in the reproductive medicine health arena. So the current global post-coronavirus and mass vaccination situation demands a joining of hands of all the expert opinion key leaders like all of us attending today and brilliantly showcasing our hard-earned efforts in the ever-expanding gynecology obstetrics field for eventual biomarker development in cost-effective oncofertility management. Next slide, please. There are lots of uncertainties involved with infertility, and there are few endocrine disturbances at the individual level that may lead to precancerous or full-blown diagnosed cancers, transmission to embryo development abnormalities, including viral chronicity, that may be affecting the offspring level. So there is a thrust on biobanking and fertility preservation. Sexual dissemination of diseases at the population level, the viral reservoir persistence clearance, and viral integration in germline and offspring genome endogenization altogether at the individual and population level, including ethnicity disparate women of varying genetic landscapes with differential traits in infertility. Next slide, please. In vitro fertilization success trends amongst infertile women of Asian Indian ethnicity, there were total embryos transferred per month that showed meaningful promising results with overall success rates and higher patient satisfaction rate with a M2 to total oocytes comparative and the overall frozen embryo transfer success rates along with the average oocyte sealed per donor. And there has been a lot of thrust these days on the enigmatic toll-like receptor molecular regulatory networks in reproductive medicine, primary infertility amongst very genetically distinct women worldwide, and partner smoking influences whether mothers quit smoking during pregnancy. So tobacco has been implicated as a causative environmental carcinogen predisposing women of childbearing age of different ethnicities lifestyle to infertility. Next slide, please. Next slide, please. Total embryos transferred were 248. I think I just switched on the slide. Previous slide, may I request a pre-transition to the previous slide? Thank you. I appreciate your expert assistance once again. Total embryos transferred were 248 in April, 240 in May, and this data set is amongst a total of 1380 women as per the inclusion and exclusion criteria defined initially. 201 in June, 254 in July, 230 August, 207 in September. So the number of pregnancies and beta HCG positivity was 171, 171, 139, 179, 176, and 163. So these are promising data sets in a considerably statistically hard large sample size of 1380 women of Asian Indian ethnicity. However, the subgroup stratification demonstrated that the M2 versus total oocytes retrieved was 72.7, 66.6%, 83.1, 73.0, 72.1, and 74.2. Interestingly, the overall in vitro fertilization success rates were 71%, 72%, 71%, 72%, 78%, and 84% in a timeline of 6 months, with frozen embryo transfer success being demonstrated as promising predictor. 68%, 75%, 74%, 85%, 77%, 83% as per the stringent inclusion-exclusion criteria. So my maternal-fetal medicine pilot study highlights promising IVF success rates in Asian Indian infertile women warranting future public health-oriented studies with dynamic collaborations worldwide. Moreover, IVF success rates, the primary endpoints being clinical pregnancy and the live birth rates, remain relatively low, primarily because of implantation failure amongst infertile cohorts belonging to diverse ethnicities. And I have a paper in Journal of Psychosexual Health in which I have focused on a specific cohort of South Indian women. So ethnicity is indeed a significant predictor of implantation trends and IVF success trends amongst women of diverse ethnicities and lifestyles and tobacco usage, either active or passive. With my scientific and clinical experience, expertise in biomedical research at premier medical centers in the United States of America, where I have worked, including states of Texas, New York, and Nebraska in the Midwest, and quality, meaningful interactions with Asian Indian patients in my home country, India, I strongly advocate the timely implementation of a cost-effective, community-based tobacco cessation infertility management guideline, public health-oriented model with robust public health research and translational research impact in the specific population subsets of varying genetic landscapes and socioeconomic strata. Next slide, please. I speculate that oxidative stress caused by tobacco and environmental carcinogen in the physiological milieu may be diminished by therapeutically targeting specific metabolic biochemical signaling pathways, for instance, the toll-like receptor pathway, the tissue inhibitor of matrix metalloproteinase, the cyclooxygenase 2 pathway that has also been widely implicated in high-risk HPV-positive cervical cancer amongst women worldwide. With cellular stress, death, immunomodulation, the last slide, please, and inflammation. In this context, tobacco-mediated DNA damage, altered aberrant sperm morphology motility, diminished ovarian reserve endometrial receptivity, thin versus thicker endometrium in both male and female clinical infertility may be studied extensively by creating biorepositories at designated nodal medical centers globally, including Asia Pacific region, India, as well as the regions worldwide. And I have a paper in the Indian Fertility Society's Fertility Science Research highlighting the role of tobacco in infertility management with public health impact. Next slide, please. Overall, in my expert opinion, stored patient clinical specimens, namely blood tissue, DNA, ribonucleic acid, RNA, sperms, embryos, and stem cells from biobanks may be strategically utilized for multicentric, cohort-based pharmacogenetic, genomic, causal association, epidemiological studies, primarily prospective, cross-sectional, large sample size-based studies involving pooled cohorts of women of childbearing age of different ethnicities, different countries worldwide for the eventual development of predictive biomarkers and of therapeutic drugs for well-defined infertility patient population subsets, including the tobacco-using subgroups of male and female patients with infertility and at-risk susceptible tobacco-consuming individuals who may be predisposed towards clinical infertility from random populations of varying genetic profiles and lifestyles. Next transition. I have few impactful publications. As mentioned in the Indian Fertility Society's Fertility Science and Research, tobacco as a significant predictor of infertility, a public health prospective in an Indian scenario. Now there is a lot of thrust going on the psychosexual aspects in infertility, in infertility amongst women of childbearing age. So I published my expert opinion article in Psychology and Mental Health Care titled Toll-like Receptors, Autophagy, Wind CRISPR-Cas, Neuroimmune Inflammatory Biochemical Crosstalks and AI, artificial intelligence, in embryonic induction and fertility management, translational health, biomedical life science research, snapshot in American and Indian genetic landscapes. So there is a lot of future opportunity, meaningful collaborative opportunities in the upcoming years, in the near future, for all of us as delegates joining hands to do meaningful research in the psychosexual aspects of oncofertility. Another publication in Journal of Psychosexuality, which is from Sage Publications, human chorionic gonadotropin HCG triggered mediated ovulation induction in infertility management in South Indian women undergoing in vitro fertilization, and ICSI regimens, which is the intracytoplasmic sperm injection as part of the assisted reproductive technology. This was a pilot sexual medicine study with public health perspective. So these publications add more scientific impact and offer fascinating avenues for eventual biomarker development, predictive biomarker development, and offer opportunities for immunotherapeutic immunomodulation of infertility amongst women on a global platform with lots of maternal-fetal medicine public health oriented impact. Thank you.